Hi, it's Dr. Epstein, here to talk about laser light therapy. Actually, more importantly, have a patient talk about laser light therapy. This is a technique or technology that we have found to be particularly effective in women perimenopausal and young men, but it works for other patient groups as well. Typically, laser light therapy works in around 70% of patients. What it does most effectively is slows down or stops altogether shedding, and then patients report noticing some regrowth and or thickening of their existing hair. Theoretically, the way laser light's supposed to work is it stimulates not only increased blood flow to the scalp, but it also stimulates the mitochondria or other elements within the cells of hair follicles, thus causing the hairs to grow stronger. Patients many times say, well, I don't necessarily believe in it, or is it going to work? And I'm very honest with patients. In my experience, around 70% of my patients are really happy with it. I have a patient here who came in from out of town. I did a transplant on her, a woman in her mid to late 50s, who I did a procedure on 7 years ago, and she started noticing in the last year or so some increased hair loss. Told her, we recommended, in addition to a transplant, ahead of time we recommended she go on laser light therapy. She's been using one of the caps for the last 3 months, and this is her in her own words, but let me just show you what we have. This is the area we're keeping her privacy, but this is the area where you can see some of the prior transplants, but this is the area where she was noticing thinning. And what have you noticed in terms of the response to that laser?
So for the last 3 months, I've been using the laser 3 times a week for 25 minutes at a time. And I have to say, I was very skeptical at first, but thought I'd give it a shot. And over the 3 months, what I notice when I blow dry my hair is that the hair does feel thicker. The texture has smoothed out quite a bit. And in my part, I can actually see new hair growth coming in. It's very fine and very light, but I can see it. And my hairdresser also commented that she could see it coming in. So I'm really thrilled with just the change in texture, if nothing else. It feels much easier to manage. It's not as flyaway. It's sort of more dense. And I'm just really thrilled, and I'm going to keep it up.
Well, this is what she's talking about. Is I can actually see some very small hairs, miniaturized hairs, and these are very consistent with the results of the early results of laser light therapy. These hairs will continue to grow. You can see some of her prior transplants, and as I said, we're here to do another procedure on her to give her more density. But I'm very happy that she has had a nice result using the laser light, because it's clearly what we see in those patients that do respond to it. Thank you very much. That's you. This is Dr. Epstein, and we're here to educate patients. We're not here to, no hyper or hyperbole, but we do find that laser light for many of our patients is effective. Anyway, it's Dr. Epstein. Thank you.